Autoimmune disease. A condition in which the immune system mistakenly attacks the body. The immune system normally guards against germs like bacteria and viruses. When it senses these foreign invaders, it sends out an army of fighter cells to attack them. Examples of autoimmune diseases are lupus, myasthenia gravis and others. In SLE, the immune system involved is related to the activation of autoreactive T and B cells which caused the production of pathogenic antibodies and tissue injury. In myasthenia gravis, the immune system involved is related to antibodies that cause defects to transmission of nerve impulses to muscle. Now, let's talk about myasthenia gravis. Table of contents. First, let's talk about the etiology of myasthenia gravis. This disease will break down normal communication between nerves and muscle. This include antibodies, thymus gland, and other causes. There are several symptoms might appear. It will affect the eye muscles which include drooping of one or both eyelids, blurred and double vision and weakness of eye muscle. Next, it will affect face and throat muscles which cause impaired speech, difficult swallowing, change facial expression and difficult breathing. Next, it will affect neck and limb muscles such as problem walking upstairs and lifting object. There are 5 stages in myasthenia gravis. First stage is any ocular muscle weakness, may have weakness of eye closure, all other muscle strength is normal. Second stage is mild weakness affecting other than ocular muscles, may also have ocular muscle weakness of any severity. This stage divided into 2 subclasses. The third class is moderate weakness affecting other than ocular muscles, may also have ocular muscle weakness of any severity. This stage also divided into 2 subclasses. Fourth stage is severe weakness affecting other than ocular muscles, may also have ocular muscle weakness of any severity which also have 2 subclasses. The last stage is defined by the need for intubation, with or without mechanical ventilation, except when used during routine postoperative management. Myasthenia gravis can be diagnosed by physical and neurological examination, blood testing, diagnostic imaging, pulmonary function testing, repetitive nerve stimulation, an edrophonium test. First nutrition problem is fatigue and difficulty with chewing and swallowing. The weakness of the tongue, jaw, mouth and throat muscles may make it difficult to chew or swallow food. At times of weakness, they may get easily fatigued during meals. This could result in malnutrition and unexpected weight loss. Next, cough or choke while eating. Throat weakness may allow partially chewed solid food to get lodged in the airway. If the airway becomes blocked by a piece of food and coughing does not dislodge it, death could be the result. Medical management. First, pharmacology management. Symptomatic treatment by anticholinesterase agents. This treatment increases the ability of a muscle to contract. Example, pyritostigmine bromide. Chronic immunomodulating treatment by immunosuppressants. Generally for severe condition. React by decreasing the inflammation and suppressing the activity of the immune system. Example, corticosteroid group. Others medical management rapid immunomodulating treatment by plasmapheresis and intravenous immunoglobulin. These treatments bring about fast but short-lived relief from myasthenia gravis and are mostly used until other medications take effect. Surgery. Removal of the thymus gland. As thymus gland is required for immune system development, this treatment is not preferred for prepubescent children and patients older than 60 years old. However, the procedure can still be done depending on the overall health of the patient and if they really wish to undergo the surgery. Nutrition lifestyle for people with myasthenia gravis. Choose foods that are easy to swallow. Take small portions into the mouth and rest frequently. Plan meals at times when muscle strength is at its best. Always sit upright while eating or drinking. Sip on liquids while eating. Increase the potassium-rich food intake. Consume food that contain abundance of calcium and vitamin D. Add vitamin B12 sources in each meal. If MG medication causes diarrhea or stomach upset. If prednisone used causes fluid retention. Diet tips for myasthenia gravis. Eat a variety of foods but choose soft food diet. Maintain a healthy weight. Choose a low sodium, low carbohydrate, high protein diet. Choose a diet low in fat, saturated fat and cholesterol. Choose a diet with plenty of vegetables, fruits and grain products. Soft food diets made up of foods that are soft and easy to chew and swallow. These foods may be chopped, ground, mashed, pureed and moistened. How to prepare soft food. Easy to swallow, easy to chew, prevent choking. Cut. Moisten. Grind. Blend. Soup. Food recommendation: fruits, vegetables, protein, dairy products, cereals and cereal products. Here are some suitable choices of food in Malaysia. Soft food diet: meal and snack ideas, breakfast, lunch, dinner, snacks. Other modification for the swallowing impaired: liquid consistency modification, temperature and taste modification, quantity modification. The etiology of SLER include: when the skin is exposed to sunlight, the DNA of the skin cell becomes damaged where the cell undergoes apoptosis. The immune system misinterprets these apoptotic bodies as an antigen, causes the immune system to attack them. Susceptible gene are not effectively clears the apoptotic bodies. The immune responses occur where the antinuclear antibodies are formed to bind with antigen, which then will be deposited into the body organ and tissues. Inflammation occur. Another factors also include: symptoms or clinical findings. How it is diagnosed. To be diagnosed with lupus, you must have 4 out of 11 common signs of the disease. Nearly all people with lupus have a positive test for antinuclear antibody. However, having a positive ANA alone does not mean you have lupus. Tests used to diagnose may include: the healthcare provider will do a complete physical exam such as X-ray. You may have a rash, arthritis, or edema in the ankles. There may be an abnormal sound called a heart friction rub or pleural friction rub. Your provider will also do a nervous system exam. Stages. For Class 1, it is where minimal mesangial lupus nephritis occurred. In Class 2, the mesangial proliferative lupus nephritis. In Class 3, where focal lupus nephritis in form of active and chronic, undergo proliferative and sclerosing. For Class 4, diffuse lupus nephritis, where it undergo active and chronic, proliferative and sclerosing, segmental and global. In Class 5, the membranous lupus nephritis. In Class 6, where the advanced of sclerosis lupus nephritis. This is overall image of all classes. Assessed nutrition assessment. Nutrition assessment of SLE patients can be assessed by: patients may be malnourished due to continuous use of drugs which increase susceptibility to infections and affect gastrointestinal systems. Therefore, the change of appetite influence the dietary intake of the patients. Assessment can be made by assessing. SLE patients usually will be assessed by the BMI range because people that have BMI more than 29.9 and are labeled as obese. Obesity may lead to inflammations. There are a few nutrition management for SLE patients. The first one is a low saturated fat and low cholesterol diet. Next, is to have adequate vitamin D status. Vitamin D supplementation with 2000 IU per day in patients with SLE is recommended. Next, is calcium. Sufficient intake of dietary calcium is essential for individuals with SLE. Sodium intake not only has no beneficial effect but also exacerbates renal dysfunction in SLE patients, who should be advised to reduce salt and condiments from their diet. For these patients, sodium intake should be less than 3 grams per day. Vitamin C is an important antioxidant, prevents oxidative stress, preventing cardiovascular complications, and lowers antibodies levels. Moderate protein intake of 0.6 grams per kilogram per day is useful for improving renal function in SLE patients. Example of life management that can improve SLE patients are: to stay active, calorie restriction, and avoid excess sun exposure. SLE can also be treated medically. Hydroxychloroquine acts by decreasing number of disease flares, decrease the damage from disease over time, delaying absorption of ultraviolet light, and reducing the number of antigen-presenting cells in the skin. Corticosteroids. It acts by stopping the processes in your body that make the molecules involved in your inflammatory response, reduce the activity of the immune system, thus prevent damage to the tissues in the body. However, it can also cause many unwelcome side effects, so it is usually prescribed only when other medications are not sufficient enough to control lupus. Cytotoxic drugs also have important role in managing SLE. Cyclophosphamide is the standard treatment for lupus affecting major organs, in particular lupus nephritis. Azathioprine and methotrexate are widely used as an adjunct to reduce corticosteroid requirements. No specific diet for the treatment of SLE exists. However, certain substances in the diet may aggravate or alleviate SLE symptoms. Aggravating substances include possible beneficial dietary compounds. Vitamin E, nuts, vegetables, oil, green leafy vegetables. Vitamin A, kale, carrots, sweet potatoes. Selenium, chicken livers, whole wheat flour, anchovies. Omega-3 fatty acids, olive oil, sardine, flaxseed oil. Diet tips.